Hi everyone, this is Kate Warnock coming to you from the garage space of the GuideWell Innovation Center. We're welcoming to our interview Sarah Iselin. Sarah, welcome.
Thank you very much.
Sarah, we're happy to have you. You are the Chief Strategy Officer for GuideWell. You know, I was looking into your background a little bit and see that you are a veteran of change in the health industry. I was wondering, what kind of lessons are you bringing into your position now at GuideWell as you plan our path forward?
Well, first, thank you, and it's such a pleasure both to be here, but also to have joined such a phenomenal organization. And you're right, it is a period with a lot of change and with a lot of uncertainty. But one of the things that we can be certain about is that our organization has successfully navigated periods like this before. So thinking about the anticipated changes to the Affordable Care Act, we're in a great position, having enrolled nearly likely 1 million members, and actually doing that and providing care to those folks and doing that successfully. And so I know that we've got the right team of leaders that even though we don't know exactly what's going to emerge from the new administration, that we're going to be able to adapt our strategy and adapt the business to continue to be successful in providing access to care for those who need it.
So that's a reassuring message, because I know that there's so much confusion and folks not sure if they're going to have their policy from this year into next year. So what I'm hearing you say is you're just making sure that the company is prepared to deliver, you know, to its utmost, regardless of what the regulation is. It's there.
And I think we've got a great team of leaders. We've got a great team of associates who have figured out, you know, this law's evolved even over the years that we've implemented it. And so even in the 4+ months that I've been here, I really have great confidence in our ability to navigate this next wave of change. We also have you know, phenomenal relationships both with leaders at the state level, with leaders at the national level, are deeply engaged with our trade associations, and so our voice is really a critical part of the conversation about, you know, how do we navigate this next phase of reform and continue to prioritize ensuring that residents of Florida have access to high-quality, affordable health care. So.
Terrific. All right. So let's pivot a little bit. You know, again, in your role, you're making sure that we're there for the consumer, and you know, as you learn more about what wellness means to the individual, and it's such a personal definition. It's not just some blanket statement. How is it that you're helping GuideWell position itself to really scale on a very personalized approach?
Yeah. So one of the things I love about the vision and the way that we talk about wellness and we talk about health and we talk about engaging our members and engaging consumers in their care is really thinking about that holistically. And in my mind, that means it's not just about the way that we engage people in accessing the healthcare delivery system or accessing their health insurance benefits, but it's actually really realizing that to keep people healthy, to keep people well, there are all of these other dimensions of our lives that matter. Right. And so I think that we're more and more really considering that view as we think about how to engage our members, so that we know, you know, if you're worried about the care of your child or the care of your parents, you know, all of these other dimensions of people's lives really impact their physical health. Right. And so I think that is part of our definition of health and wellness. And I think as we articulate our future vision for consumer engagement, we'll be thinking about more and more of those other dimensions of people's lives and thinking about people really holistically.
You know, we had our Chief Operating Officer, Dr. Prakash Patel, join us earlier, and he was describing how GuideWell's even really looking to move more into the home and really address people. He said, you know, care doesn't really happen. He said, yes, it happens within the four walls of a doctor's office, but 362 other days of the year, it's more than likely it's really in the home. So it sounds to me like you're really focusing on all of those things, as you said, the holistic approach to the individual. It's not about the episodic physical wellness checks. It's really about the whole person.
And I think, so it's about the whole person, and it's also about being flexible and really realizing that we need to meet people where they are. And support their health, support keeping them healthy, support people who have chronic diseases, helping them manage them. But you need to do that in a way that is really flexible and realizes that there isn't a one-size-fits-all solution, and that we need to be able to engage our members differently, depending not just on what their health needs are, but also the way in which they want to receive care. And I think Dr. Patel's exactly right. Who wouldn't want to receive care at home? Who wants to go to a hospital if they don't need to? And so I think thinking about that in a way that is innovative, that is flexible, and that is just also really practical, and at the end of the day is really person-centered. You know, the more that we're able to put ourselves in the shoes of our members, put ourselves in the shoes of our patients, the better we're going to be able to meet their needs.
So you certainly are reflecting, you know, so many conversations, you know, in the health industry, the personalization, the consumer-centric approach. Where do you think the health industry is really going to continue to evolve in the next 3 to 5 years?
Well, I'm an optimist by nature, but I do think the biggest challenge that the health industry faces is making healthcare affordable. So the underlying cost of healthcare continues to grow faster than any of us would like it to be, which poses just real challenges for us as a health plan and a health services organization, trying to keep all of the services that we offer, from health insurance products to other services, keeping them affordable. And I think it's a problem for the whole community. It's a problem for us in the United States, given that we look at the next highest spending country on healthcare, and they don't spend as much, and in some cases they get outcomes that are at least as good, if not better, than ours. And so I'm optimistic that as a community there's an increased recognition of the need to really tackle that problem, that there's a lot of innovation, there's a great entrepreneurial spirit that is such a key feature of American culture and American healthcare, that we're really going to bring those resources, we're going to bring that creativity, we're going to bring that innovation to bear in service of really ensuring that we've got a consistently high quality and cost efficient, affordable healthcare system. And so I think that's where we need to get. As I look ahead over the next 5 years, I think that's also our biggest challenge. But I'm really optimistic that we've got what it takes to achieve the vision if we all work together collaboratively.
Well, I think what you speak to, it's really how is GuideWell going to deliver on its mission, which is helping people and communities achieve better health, and that means everybody.
Yep, absolutely.
And so that access and affordability really becomes critical. So, well, Sarah, it was so nice talking with you today. Thank you for joining us here.
Thanks so much for having me.
My name is Kate Warnock. Thank you so much for watching.